shirt as me. But I made up to him by, I asked him if he'd be kind enough to read the two stories that I've written, because I couldn't decide which story to read. And so here's story one and here's story two, and if you don't like them, you can blame Colby. Which one did you say, by the way? Okay. Okay, so my name is Anthony. I think I've met most of you yesterday. I live just north of San Francisco, and I've been volunteering with the NPAF for about a year since I retired. When I first moved to the US about 30 years ago, I was often asked, people would say to me, wow, it must be great living in the USA, that fantastic medical care, doctors everywhere, treatment for anything. I sort of avoided answering that question because it was just too painful. So 30 years on, and I'm now a bit more prepared to answer that question when I'm asked it. In broad terms, I can say that there are four pillars to the US healthcare system. Number one, there is employee-based, profit-driven health insurance. Number two, Medicaid. Number three, Medicare. And number four, the health exchanges set up through the ACA, which perhaps soon are going to have to be renamed No Care, sadly. The question today in front of us is the cost of care. So how do these four pillars stack up when it comes to the effectiveness and the cost of care? Here are a few numbers that help answer that question. There are 28 million people who have no health insurance. They can't afford it. There are 40 million people who can't afford to pay their deductibles, their co-pays, or their out-of-pocket expenses. 19% of Medicare beneficiaries in the year 2016, that's 6 million people, had no supplemental coverage and paid on average close to $6,000 out-of-pocket expenses. Unpaid hospital bills are the single biggest cause of bankruptcy in America, for private individuals, I should add. So based on these numbers, I would say it's fair to say that the cost of care in the USA is not affordable. But hey, maybe it's very good, the care, and maybe it's effective. So we put up with the cost. Not so, I think. The USA has, in fact, one of the lowest life expectancies of all developed countries. And it also has the highest child and maternal mortality rates. Put these two together, and I think it's fair to say that healthcare is neither affordable nor very good. I grew up in a medical family. My dad was in the first intake of doctors in 1948 to the then fledgling National Health Service. And my mum ran a Planned Parenthood clinic. Quite why I didn't become a doctor, I'm not sure. But as everyone probably knows, the UK is one of the many countries in the world where healthcare is a basic entitlement. Of course, the NHS is not without its challenges, especially its burgeoning cost. But at least one does not have to worry about the possibility of being bankrupted by illness. Here in the USA, we hear now a lot of people talking about wanting to keep their doctors and not wanting to lose their private insurance. And in the event of a switch to some sort of single-payer healthcare system. But I'm not sure I really understand this. It doesn't seem to me to be a choice that anyone needs to make. For example, with education, every child in the USA is entitled to free education through grade 12, I believe. If you want to upgrade this basic level of education, you can do so. You can send your child to a private school. Exactly the same principle applies or should apply to healthcare. And in fact, that is exactly the same system that exists in most countries in Europe and many also in Asia. We're heading now to the presidential election next year, and healthcare fantastically seems likely to be a very, very big issue in the forthcoming election. It's impossible to say what the outcome will be. But if nothing else, I think we can dare to hope that we will take steps towards a USA where everyone can receive a basic healthcare and no one will be bankrupt by illness. I, for one, am very energized and will return to San Francisco determined to what I can do to help the NPAF and its mission. I'm proud to have become involved with the NPAF, an organization that cares for the patient and helps people to navigate the very complex and costly healthcare system. Thank you for listening to my story, and thank you, Colby, for choosing the right one.